So I already discussed sort of what was the path and what was the journey that led me up to leaving residency. But now I really want to share, and that was with all of the decision making and knowledge that I had at that time and how I was feeling at that time. And now I want to share sort of what is part two in terms of the knowledge that I have now that I've been able to reflect back and see, okay, were there warning signs? Were there things that I should have picked up on in terms of realizing that I didn't want to work in clinical medicine, or just feeling like I was getting to this place of burnout or needing to leave, and sort of painting that picture for people in case that's helpful for them, and just as part of my story, because at the time I didn't realize any of this information, and it's only been since I've left and been able to reflect more that I now understand it. So, kind of running back a little bit, and people say, well, why do you think you got to that place? Why do you feel like you got that, like, burned out and depressed and felt like you needed to leave? And how did you not realize sooner in your medical career that maybe this wasn't the path for you? And I'll explain that in a couple of different things. I will say that, growing up, I was the kid that was sort of always prided for my academic achievements, as I think a lot of pre-meds are. And I liked the sciences. In high school, I was thinking, okay, well, I'll go into nursing. I took an anatomy class, really liked it. And then family members and other people started encouraging me and saying, have you thought about medicine? And to be honest, I hadn't. I didn't have any perspective of what medicine really entailed. I only had nurses in my family. I didn't know any doctors. And so I hadn't truly considered it. And I think that's something important to keep in mind, is I feel like you're only as exposed as to the careers that you're exposed to. You just don't know any more than that. And so I didn't know. And so, family members and people encouraged me to sort of look into it more, said, I think you're smart enough. I think, you can totally do it. You should shadow some doctors and see. So I shadowed some local doctors where I was and decided, okay, yes, I like this. I will say I only shadowed them in an outpatient setting. I like this. I'm going to go pre-med in college and become a physician. And once I jumped on that train, I just felt like it was going nonstop, and I never really jumped off, which I think is true for a lot of people, is you never really reconsider your decision in terms of why you've gone into it. People have told you that you should, or that you're smart enough, or that that's the way that you can go into a career where it includes science and helping people and a bunch of different things, and it's well respected. And so I just never really reconsidered. Everything that I did from that point on was trying to take the best classes, trying to keep my GPA high enough, trying to get the best MCAT score, all of those, making sure I have activities, and just getting so wrapped up in the system of what it takes to get into medical school. And so, when I was applying to medical school, some of this is just walking through my story so that you understand a little bit more about who I am and potentially why I got to the end point that I did in terms of leaving clinical medicine. I really enjoyed a lot of the community activism work, even that I was doing in college, regarding health literacy. And when I went to apply to med school, that was something that I found sort of equal footing on and grounds in terms of Texas Tech El Paso, because it was on the U.S.-Mexico border. They worked with underserved populations. That was really important to me, really wanting to work with, those type of populations and feeling like I was making a difference and helping people. And also, I had always wanted to learn Spanish. I had been taking Spanish since I was all the opportunities I had gotten in high school and in college and stuff. And so I felt like this was the chance for me to actually be using and practicing Spanish in real life, in terms of my daily life and my patients. And we took medical Spanish as part of our curriculum. And so that stood out to me as well. So sort of all of that sort of came into the package of me ranking them. Texas does a ranking system, so ranking them as my top school of the Texas schools that I looked at, and ultimately matching there for the Texas match system. So that's different for some people, because Texas essentially does what residencies do in terms of creating a rank system and matching, as opposed to other schools where you just get accepted. But yeah, I did, because I'm a Texas resident, I did the Texas matched at my top choice. I wanted to go to Texas Tech El Paso, and I was really happy there, to be honest. When people say, Did you have warning signs in med school? Of course, there were things I didn't like. Certain rotations I didn't like, or certain things I didn't want to do. I didn't love studying for my step exams, but nobody generally does. And I had a good sense of community there. I had a really good friend group. I really enjoyed what I was doing in terms of community advocacy at school, starting our student-run clinic, helping people in the community. And so in a lot of ways, I think that, looking back now, I think that gave me a sense of fulfillment that then quickly disappeared in residency. As soon as I got to residency and I didn't have time for sort of outside activities, I noticed that lack, and I wasn't feeling personally fulfilled in what I was doing. And people say, well, yeah, but you were taking care of patients. Didn't you enjoy that part? I always did to an extent. But more and more, as you get into certain places, you're responsible less for just interviewing the patient or just seeing the patient. You're responsible for all the other things that go along with that. Maybe for a 10-minute patient encounter, you have 20 minutes of administrative work, at least, that includes writing your note or checking with the pharmacy or checking with our specialists or talking to the nurses or whatever. So that, I didn't ever get that clue really in med school. There were a couple times where I was like, why am I doing this to myself? Sort of feeling really, really stressed out. The same sort of feeling of why am I doing this to myself that I had in residency. But I felt like overall I enjoyed what I was doing. And I think that's ultimately why I ended up in pediatrics. Why I pursued pediatrics is because I had a real interest in public health, preventative health, and feeling like with kids, you get to sort of start that process early. And sort of tap into a more community health perspective through the younger generations and feeling like you're making an impact. And so that's why I really liked pediatrics too. And I still do. I love children. That was never an issue in terms of me going into pediatrics. As I look back now, one of the biggest things though that I have sort of pinpointed that I didn't, for a long time I didn't see, is was actually during college when I was applying to med school. I got a biology degree and a psychology degree, a BS and a BA. And I had essentially finished all of my biology requirements my junior year. I had gone in with essentially a year of credit from taking AP classes and that kind of stuff. And so I could have graduated early. And my pre-med advisors at the time said, no, that doesn't look good. You shouldn't apply early. Essentially do the normal thing of like doing college for 4 years. I don't agree with that. Do whatever you want to do. But I don't feel like that's pertinent advice these days. Take it with a grain of salt or whatever you will. So I was like, okay, well, what am I going to do for the last year? I've already finished my biology degree. So I tacked on a psychology degree. And those were classes I knew I had always loved. I had loved psychology in high school. I had loved my intro psychology classes. And I loved them my senior year. Those were the classes that I honestly loved more than any of my science classes I took. There were certain science classes that I liked, but my psychology classes I always loved more. I loved my cross-cultural psychology or my developmental psychology or my physiological psychology or all of these different classes that I took. And there was a point during my senior year where it was like, oops, like, am I doing the wrong thing? Where I questioned my choice to enter medicine. But by that point, I was already, I had already taken my MCAT. I was already applying and felt like I've come this far. I can't turn back now, which is a consistent theme you see a lot throughout medicine. And so I felt like looking back, I feel like I didn't give enough true weight to going into clinical psychology or something else in another field because your path for medicine starts so early. And sort of once you're on that path, and like I said, once I was on that train and had already gotten my letters of recommendation, all the things, like I was just kept going. But also, looking back, that was a time when my sort of mental health journey really, really peaked. I had never been medicated for anxiety or depression or anything until my senior year of college when I was applying to med school. And I mean, it is an anxiety-provoking time for everyone. So I don't want this to be discouraging of people of like, if you are scared or worried about the process, like it's natural to not know and feel like you're not in control of the process, because you pretty much aren't. You're just kind of throwing everything out there. But for me, these were probably bigger warning signs that I wasn't seeing at the time. And so, things just like right before I turned in my application, just being so anxious and so nervous, and just like leaving and driving like 12 hours to go visit my family because I felt like I just like needed to sort of check out. I think it was sort of that last ditch effort to be like, am I doing the right thing? I need this assurance from everybody that like, I can do this, that I'm doing the right thing, because I think internally I was questioning it and I wasn't really giving that weight. So that's what I mean by, at the time, I didn't realize that. Even when I left medicine, I didn't realize that. But looking back now, things like that were important checkpoints where I should have taken more time to really reflect instead of bulldozing through my feelings. And so I say that to be illustrative for people who maybe feel like they don't have the opportunity or the chance to do that, or they don't feel like they can. They feel like they've already told family they're applying, or their family has always expected they're going into medicine, or whatever reason. Really to feel like you know who you are going into medicine and you have clarity about the career you're going into, and all of these things, because I think in college I hadn't truly given it enough thought. It just felt like what I was supposed to do because I was a smart, caring person, to be quite honest, and I was competent and I could do it. So that's something to keep in mind. Sorry, I do not know what's happening with this cough. Maybe it's the tea I'm drinking, actually. So I think it's important to see sort of from the different perspectives. This is what I experienced at the time, that I discussed in sort of the first part. What I was really feeling, and feeling like I need to be protective of my physical, also my physical health, my mental health and my physical health. At the time I weighed more than 300 pounds. I've since lost more than 100 pounds since leaving medicine. And so I was just sort of in this place of being a constant, anxious stress ball, destroying my mental health, my physical health, binge eating to cope with my feelings, or napping to avoid things, like just kind of in a bad place. And so since I've been able to leave and sort of look back, what do I wish I would have known? Where do I feel like I wish I would have had those stops? Where do I wish somebody would have said to me, like, hey, is this really what you want to do? Or, hey, like, make sure that you're more self-aware, you know who you are, you're focused on your personal wellness, and you know how to cope before we put you into a more stressful situation like med school. And so that's sort of my my mission here, is to make sure that people really have clarity.